Hello and welcome to Enchanted Hospital. On today's episode, we're going to be talking about the medication Propranolol. Now, what does Propranolol do? It works by blocking the effects of a hormone called adrenaline. It slows your heart rate and makes it easier for your heart to pump blood throughout your body. It is usually prescribed for high blood pressure, but it can also help with physical signs of anxiety like sweating and shaking. Because it affects all adrenaline receptors, it can make it more difficult to breathe. So if you have certain lung diseases, Propranolol is not for you. So I'm about to administer medication to Prince Florian. I have already completed my 5, 7, 9 rites, as well as checked the patient's medical record for any allergies. I have also verified that his vital signs were within normal range, and it is safe to give him his Propranolol. Oh my, you have a lot of visitors in here today. Prince Florian, I'm Nurse White. I'm here to give you your medication. Can I start by getting your name and date of birth?
Yes, it's Prince Florian, and the birthday is 11/1 of 94.
Thank you very much. Now I have your Propranolol here. Do you know what this is for?
I don't. What is it for?
So Propranolol is for high blood pressure. When you came in, you were complaining of severe headaches. Upon our assessment, we found that your blood pressure was extremely high. So the doctor would like to start this medication as soon as possible to help with your high blood pressure.
Okay. Is there anything else I need to know about it?
Well, you're going to need to take this medication every day, okay?
Okay.
Before you take the medication, you're going to want to check what your heart rate is, okay? If your heart rate is less than 50 beats per minute, you do not want to take the medication, okay?
Okay.
We also need to know what your blood pressure is before taking this medication. That's usually taken about twice a week, okay? Okay, do you know where you can get a blood pressure cuff at home?
Yes.
Okay, so you can go to either CVS, you know that, Walgreens, or Walmart.
Okay.
Okay. All right. Now, another thing that I want to tell you is you should take this medication on an empty stomach unless you have an upset stomach with the medication. In that case, you can have it with a mild meal. Okay?
Okay.
Okay, and then you never want to crush this medication.
Okay.
You're also going to want to reduce your sodium intake, exercise regularly, drink alcohol in moderation, and stop smoking. Do you smoke?
Nope.
Perfect. Okay. All of these are going to help with your high blood pressure as well as with taking your Propranolol. Okay. So I've completed my rites, and now the patient is going to take his medication. Thank you very much, Prince Florian.
Wait.
John D, I'm so sorry, but you can't take this. This medication messes with your liver. It's going to decrease how your liver functions, and that would not be good. We want to keep you healthy.
Can I have some Propranolol? The prince took it and he got Snow White.
Yes, well, I'm sorry, COPD. However, Propranolol is a non-selective beta blocker. So in your case, it's going to make it more difficult for you to breathe.
Well, that's not fun.
No.
I want to be like Prince Florian.
Well, Wheezy, from what I can see, it looks like you have asthma. Propranolol is not suggested for patients with asthma, as it is a non-selective beta blocker, which is going to potentially cause you to have a asthma attack.
Oh man.
What about me? I have hypertension. Can I have propranolol?
Oh, well, let's see, Beatus. Can I get your date of birth?
My date of birth is 03/15 of 1971.
Okay. Well, Beatus, it looks like you have type 2 diabetes. Now, what I see is propranolol is not recommended for patients who have diabetes because it can mask the symptoms of low blood sugar.
Oh, okay.
I want to try propranolol.
Oh, Dizzy, I'm so sorry, but propranolol actually works by lowering your blood pressure. And from what I can see, you already have low blood pressure. So, propranolol should not be taken if your systolic pressure is less than 100 beats per minute.
Oh man, I wish I could take propranolol.
I'm ready for my propranolol.
Oh, Sleepy, you're so silly. Unfortunately, your pulse is less than 50 beats per minute. If I didn't know any better, I would think you were dead. So propranolol is definitely not for you.
Nurse White, I'm not taking my propranolol anymore because Prince Florian's taking it and I'm not being like him.
Grumpy. I don't want to hear that. If you stop taking your propranolol, it could have some serious life-threatening effects, such as a heart attack or chest pain. So never stop taking your propranolol right away and contact your doctor.
I'm gonna tell him I don't want to be like him, so I'm gonna have a heart attack.
Oh, Grumpy. Well, Prince Florian, it looks like I have your discharge papers. Are you ready to get out of here?
I am.
Good. Okay, we're going to go over just a couple of things before you can leave, okay?
Okay.
Firstly, you're going to need to take your blood pressure twice a week,
Okay.
okay? To do this, you're going to place this on your upper arm, wrap it around so that it's tight but not too tight, okay? Now
Okay.
relax your arm and we would start the machine.
Okay.
Now remember, if your top number of your blood pressure is less than 100, do not take the propranolol and call your healthcare provider,
Okay.
okay? Now, something that you're going to need to do every day before taking your propranolol is checking your heart rate. You can do that by placing your fingers right here.
Okay.
This is your radial pulse. You will count this for 30 seconds and times that by 2. Now I'm going to have you feel. Can you feel your radial pulse?
I can.
Okay. Now, if this number is less than 50, do not take your propranolol,
Okay.
okay? And call your healthcare provider.
Okay.
Now, can you explain to me what we just went over?
Yes. You told me that I needed to take my blood pressure 2 times a week, and that if the top number was less than 100, I could not take my medicine and I needed to call my healthcare provider. And I needed to check my heart rate, and to do that I feel it here and I count how many beats in 30 seconds and then I times that by 2, and if that number is less than 50, I do not take my propranolol, my medicine.
Yay! To recap, Prince Florian came in here complaining of severe headaches. Upon our assessment, we found that his blood pressure was extremely elevated, and the doctor wanted to start propranolol. Now, we advised him to not take propranolol with food in his stomach. We want an empty stomach. Also, we told him that if his systolic or top blood pressure number is less than 100, he should not take the medication. As well as if his heart rate is very slow, less than 50 beats per minute. We also encouraged him to do movements slowly. This is going to help prevent him feeling dizzy from going from a lying to sitting up position, as well as sitting to standing. I also instructed him to never crush this medication, as the effects of the medication can be diminished. I also advised him that if he develops any lung-related illnesses, to contact his healthcare provider, as propranolol is a non-selective beta blocker. As well as, now that he's on propranolol, he can be more susceptible to the cold. He'll want to wear a jacket. And to not stop taking his medication right away, as it has serious life-threatening effects, such as a heart attack or chest pain. Well, this was another great episode of Enchanted Hospital. Prince Florian has now been discharged and is going to live a healthy ever after. We'll see you next time, where Belle is wondering why Beast all of a sudden has alopecia. La 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 la. I want some.
I want to be like Prince Florian.
Well, Wheezy, from what I can see, you can't laugh at me.
Can I have some propranolol? Because the prince took propranolol and he got Snow White.
Well,
I was
yeah.
gonna say action.
Action.
Oh no.